Target 8 brought you the investigation last week. Hospitals that keep a carefully guarded secret the number of infections that patients get while they're in the hospital.
Tonight, investigator Henry Erb is here to follow up on that report. Henry?
Well, after our story appeared on air and online last week, we heard from a Grand Rapids man who has waged a lone campaign to get a state law requiring hospitals to reveal their infection stats. His campaign so far has failed. Jim Corbett has folders full of letters, emails, and reports he has sent and received, correspondence with members of the Michigan House Health Policy Committee.
I resent the fact that I don't know when I go into a hospital whether I'm at low risk or high risk of acquiring possibly a lethal infection. I'm never afraid to go into a hospital for treatment. I'm afraid of acquiring an infection.
Corbett says he has received great care in Grand Rapids hospitals, but got interested in the subject when a cousin died from an infection acquired while being treated for cancer. He's been working to get the legislature to adopt a law requiring hospitals to publicly report their infection rates. But hospitals say it's hard to track infections from their source. Some hospitals may have sicker patients, making comparison unfair, and there would have to be a lot of public education for people to understand what the numbers mean.
The hospitals make a good argument, and part of it's cost, and part of it is just they don't want the public, they fear the public's going to misinterpret the reports. But that's true of any report. You can misinterpret it. It's up to them, when the report's issued, to explain.
So far, Corbett says he has received some interest from legislators, but he's up against an influential healthcare lobby. 3 different bills since 2005 died quietly without being brought out for a public hearing. And there is no organized heavy-duty pressure group in Michigan backing up his plea, according to one national organization lobbying at the federal level. Corbett says 27 other states require some level of public disclosure of hospital infection rate.
So it could be that Michigan may end up being the only state out of all 50 where hospitals aren't required to report.
Jim Corbett is retired from a career with the Social Security Administration, expresses some frustration, but is full of enthusiasm and doesn't appear likely to give up his campaign for public disclosure. He says if Michigan hospitals don't disclose their infection numbers, the federal government might eventually force them to do it.